Welcome to Tom Talks, where we breathe easy, think clearly, and master respiratory care one topic at a time. Today's topic: how to fully interpret an arterial blood gas, or an ABG, in just a few simple steps. We'll start by analyzing acid-base balance, and then move on to evaluating oxygenation, just like you do in clinical practice. Let's go ahead and get started. Step 1, you're going to need to check the pH. A normal pH ranges from 7.35 to 7.45. If the pH is below 7.35, the patient is acidotic. If the pH is above 7.45, the patient is alkalotic. If it falls within normal limits, compensation might be happening, but we'll confirm that in a moment. Step 2. Find the primary driver of the acid-base imbalance. Look at the carbon dioxide, or CO2, and the bicarbonate, or HCO3. If the CO2 moves in the opposite direction of the pH, it's a respiratory problem. If the bicarbonate moves in the same direction as the pH, it's a metabolic problem. For example, a low pH with a high CO2 points to a respiratory acidosis. A high pH with a high bicarbonate points to a metabolic alkalosis. Step 3. Check for compensation. If the opposite system is attempting to correct the imbalance, but the pH is still abnormal, you have partial compensation. If the pH has returned to normal, but the CO2 or bicarbonate remains abnormal, that's full compensation. Remember, the body always tries to maintain homeostasis, but it isn't always successful. Step 4. After assessing acid-base balance, evaluate oxygenation. Look at the PaO2, or partial pressure of oxygen in arterial blood. In normal PaO2 on room air is about 80 to 100 millimeters of mercury. Also check the oxygen saturation, or SaO2. Typically we want this to be greater than 90%. If the patient is hypoxemic, that should guide your next clinical priority, even if the acid-base balance, it looks good. If the patient is hypoxemic, that will guide you to your next clinical priority, even if the acid-base balance looks good. Quick tip: if you're ever short on time, match the direction of the pH with either the CO2 or the bicarbonate. Whichever one moves in the same direction is usually the primary problem. To recap, Step 1, check the pH. Step 2, find the driver. Step 3, look for compensation. Step 4, evaluate oxygenation. Let's put this into practice. Before we dive into abnormal examples, here's a completely normal arterial blood gas for reference. The pH is perfectly balanced at 7.40. The carbon dioxide is normal at 40. The bicarbonate is normal at 24. Oxygenation looks good with a PaO2 within normal range and a saturation greater than 90%. Keep this baseline in mind as we work through different acid-base disorders. Now let's take a look at respiratory acidosis across its 3 stages: uncompensated, partially compensated, and fully compensated. In the uncompensated state, the pH is low at 7.25. The PaCO2 is elevated at 60. That's your primary issue. The bicarbonate is only mildly elevated, which means the kidneys haven't had time to respond. This is acute and uncompensated. In the partially compensated case, the pH is still low at 7.30, but you'll notice the bicarbonate has increased to 32. That tells us the kidneys have started to retain more base in an attempt to correct the acidosis, but we're not back to normal yet. In the fully compensated state, the pH has returned to near normal at 7.38, but PaCO2 is still high and the bicarbonate remains elevated. This means compensation has done its job. pH is restored, but the underlying respiratory issue is still present. Notice that in all three cases, PaCO2 is the driving factor. That confirms we're dealing with a respiratory disorder. Now let's break down respiratory alkalosis across the compensation spectrum. In the uncompensated example, the pH is high at 7.52 and the PaCO2 is low at 25. The bicarbonate is still within normal range, so the kidneys haven't adjusted yet. This is an acute respiratory alkalosis without compensation. In the partially compensated case, the pH is still elevated at 7.48 and the PaCO2 is even lower at 20. Now we also see the kidneys are starting to respond. The bicarbonate has dropped to 20, the compensation has begun, but the pH is still abnormal. In the fully compensated state, the pH has normalized at 7.42, but both the PaCO2 and the bicarb are low, 27 and 17 respectively. That tells us the respiratory issue is still present, but the kidneys have fully adapted. As always, remember, compensation changes the values, but not the root cause. Here, low PaCO2 remains the driver, confirming its respiratory alkalosis. Now let's look at how metabolic acidosis presents across different stages of compensation. In the uncompensated state, we see a low pH indicating acidosis and a low bicarbonate at 18. That's our primary problem. PaCO2 is still normal, so there's no sign that the lungs have started compensating yet. In the partially compensated case, the pH is still low at 7.32, but PaCO2 has dropped. This shows us the respiratory system is trying to blow off CO2 to reduce acidity, but it hasn't brought the pH back to normal just yet. Finally, in the fully compensated state, the pH has returned to normal at 7.36. Bicarbonate is still low, but now PaCO2 is also decreased. The lungs have successfully adjusted to bring the pH back into range. Across all three examples, low bicarbonate is the primary disturbance, which confirms we're dealing with metabolic acidosis. The level of compensation just tells us how long the body has been trying to fix it. Let's take a look at metabolic alkalosis across its compensation stages. In the uncompensated case, the pH is elevated at 7.48, and the bicarbonate is high at 30. PaCO2 is still normal, meaning the lungs haven't started responding yet. This is classic acute metabolic alkalosis. In the partially compensated example, the pH remains elevated at 7.46, but now PaCO2 is also elevated at 46. This tells us the respiratory system is beginning to retain CO2 to help bring the pH back down. Compensation is underway. And in the fully compensated case, we see the pH normalize at 7.42, even though both bicarbonate and PaCO2 remain elevated. This means the lungs have fully adapted, and the body has restored pH balance. Since the primary disturbance is the elevated bicarbonate, this confirms metabolic alkalosis, with the level of PaCO2 indicating how far compensation has progressed. Alright, now it's your turn. Look at the three ABGs on screen and try to interpret them. Start by checking the pH. Is it acidotic, alkalotic, or normal? Then look at PaCO2 and bicarb to figure out which system is causing the problem and whether the body's trying to compensate. Don't forget, a normal pH doesn't always mean the ABG is normal. Drop your interpretation in the comments, and more importantly, tell me why you think that's the correct answer. I'd also love to hear your feedback. Was this helpful? Are there any other topics you'd want me to cover in future videos? Your suggestions help me make content that actually supports you. Thanks for watching, and keep sharpening those ABG skills. Remember that eventually every problem turns into a respiratory problem.